Hi, I'm Janine Paulus, Certified Aesthetic Nurse Specialist at Chicago Aesthetic Surgery Institute, the practice of Dr. Stefan Stadba. Today I'm going to be demonstrating an injection of Kybella. Kybella is a new medication. It's made by Allergan and it's used to melt submental fat, or in layman's terms, the double chin. Our patient today has what we call submental fullness or double chin. So what we're going to do is inject that part of the chin right here above the Adam's apple and right underneath the chin to help eliminate this fat. There's very specific areas of the neck that Kybella is used on. It's not used all over the neck, only in the what we call the submental area or underneath the chin. So what we've already done was we've cleaned her face and applied numbing medication. So I'm going to double check her neck, just have a quick exam. So this is the fat that I'll be injecting. So I'm going to ask our patient to grimace, make a face like this, sort of to check the fat. So it's this fat here. We're not going to be treating anything on this side. Kybella is not meant for that area. This is the area we're going to be treating. She already has numbing medicine on, so I'm going to wash it off and we're going to begin our marking process. Marking is critical to make sure that we get the medication in the right areas. There's certain structures of the face that we want to stay away from so that when we inject, we're going to mark those structures off. I'll apply a template that has essentially a grid on it that's going to show me exactly where to put the needle and where to put the injections. I'm going to use some rubbing alcohol and some cleanser to make sure we have a clean surface of the skin. So now I'm going to look for our landmarks. So with the patient's head down, everybody has a little bit of a crease right underneath the chin here. So that's our first landmark. And I'm going to mark it off. So this is a no-fly zone. This is where we don't inject. Then I'm going to look for the patient's bone, for their jawbone here, for the mandible. I'm going to go about 1.5 centimeters or about a finger's breadth away from that edge and mark that. That's our no-fly zone. Now we do the same on the other side. I find the bone about 1.5 centimeters away, our no-fly zone. Then I'm going to look for, there's a little bone in the neck here that's above the Adam's apple. So our treatment area basically is here. I'll be applying a grid that's going to leave a little dots, a tattoo dot, right on the skin as my guide to inject the Kybella. So this is what we call our skin marker. This is going to be placed dot side up on her neck. I'll take the plastic off. It's going to be placed here. And these dots will transfer onto her skin, which is going to show me, be my guide to inject the medication. So what we're going to do now is cool her skin a little bit. I'm going to put an ice pack on her neck here. I'll take this away. I'm going to wipe her off once more with alcohol. So we're going to start going just beneath the dots on the top. Small stick. How are you feeling?
So far, so good.
So that was a Kybella treatment. It doesn't take very long. We're finished injecting, and this is what the neck looks like after an injection. We put the ice pack on it afterwards to help cool it down. So this is the time that it may start stinging a little bit, and the ice will help. So how was that in terms of a treatment?
Actually, not bad.
Was it painful?
No, not really. I'm waiting for it to start burning, but
It
we'll
might
see.
start burning, and if it does, then you can apply ice. So overall, what would you say your experience is with your first treatment of Kybella?
It wasn't bad. It was a lot quicker than I expected, and I guess we'll see how things work over the next. How long should it take?
So usually we wait anywhere from 4 to 6 weeks. So this is done in a series. If there is a little bit more submental fat, then it may take up to 2 or 3 treatments, sometimes more, but that's to be determined at the time. If the neck is still swollen at 28 days or at 4 weeks, then we'll wait another week or 2 until all the swelling is down before we do the next treatment. So what she can expect in the next few days is actually quite a bit of swelling. So don't be surprised when you're not, looks like a big puffer ball there. That's just part of the reaction of the fat to the deoxycholic acid to the Kybella. The process of melting the fat has begun, and that goes on for about 28 days. And after 28 days, we'll reassess and see how the neck looks at that time. So what I'll tell her is that if there's anything that feels unusual, strange, it will be red and swollen, but if there's any pain that radiates to any part of the face or any kind of tissue discoloration other than a bruise, to give our office a call right away and to come back and we'll take a look. This is a very safe treatment. Really, with any treatment, there's always a risk, but this is relatively safe and quick, and it's a great way to get rid of that little packet of fat that you have underneath your chin that really bothers a lot of people. So I think we'll see in 28 days how she looks. So join us back in 28 days and we'll show you our follow-up visit. So our second patient for a Kybella injection today has a different anatomy, a different kind of neck than our first patient. So the first thing I'm going to do is check for submental fat. This is the pinchable fat that we're going to be treating today. I'm going to look for my markers so that we can mark our no-fly zones. Again, I'm going to look for what we call the submental crease, or the crease right underneath the chin. And I'll draw a line across. We're going to find her jawbone and go about 1.5 centimeters beyond that. Same on this side. So this is our no-fly zone. Then I'm going to have her grimace, so do this. So this helps delineate where the fat pocket is. Okay, relax. We're going to look for the bone in the neck, the hyoid bone, which is above the Adam's apple here, and mark her off there. So these are areas that we stay away from. So her treatment area basically is going to be right here. We'll apply our template now so that we can transfer the dots or the tattoo to her neck so that we have a guide when we start injecting the neck. This is our template, the same as with the first patient. So her dots are on. What I'm going to do is put her in a more comfortable position. Why don't you ice it for a minute? Clean off the skin once more before the needle goes in. That's a no-fly zone there. And we'll start injecting. So what you're gonna feel at first is some stinging, a little bit of burning sensation. How's it so far?
Okay.
We don't want any medication drips or anything on her skin. Does it sting yet?
It's tolerable.
We're done.
Oh,
So now.
That's it?
That's it. So you can apply the ice.
not bad.
How would you say was this? Very painful, tolerable, comfortable,
Very tolerable.
very tolerable?
Mm-hmm.
Does it sting now or
It feels a little tight,
a little tight?
a little sting, but not bad.
So what she can expect over the next 24 hours is some submental swelling. So she's going to get quite a bit of swelling here underneath her neck. She can apply a cold compress to her neck to help with the discomfort and take some Tylenol if she needs something for pain. And over the course of the next 28 days, the fat in the submental area should start to melt. Basically, it'll just be reabsorbed by the body. At 28 days, we're going to see how her neck looks to see if she needs a second treatment. We'll determine at that time if the swelling has gone down sufficiently to proceed with the second treatment if she needs it, and if the decision is made that maybe it's just a little bit too swollen and too tender yet, then we'll wait another week or two before we do the next injection. And that's Kybella. It eliminates the double chin.